The first thing is, again, just being able to convey the right information to the treating doctor. Okay. Then radiology. See what we are doing in radiology and pathology. In radiology, we are basically seeing the images and making the diagnosis. It is relatively less invasive because it's just, the patient goes in the machine and an image is taken.
Yeah.
In pathology, what we are doing is, once if something is identified in radiology, we go into that lesion or whatever is identified, and we directly test it. As a pathologist, if I get some extra information from a radiology report, it does help in in the diagnosis. Histopathology, for example, is kind of a gold standard for most of the diagnoses. There are many, especially cancer diagnoses, cannot be, they can only be suspected on radiology, but they can be confirmed on histopathology. So getting that information, that kind of information from a radiology report helps a pathologist to make a better decision. Either these two reports help the clinician to understand the disease better, the spread of the disease, the extent of the disease, the surety that the disease is there. It becomes like a team.
Yes.
Radiology, pathology, clinical side, everything, it becomes a team. And if we talk about how radiology and pathology sometimes need to collaborate,
exactly.
The biggest example is image-guided biopsies. As we were just talking about, there are certain tissues which are inaccessible, easily.
Yes.
But sometimes you just have to take the biopsy. There's no other option. What would you do? We use image-guided biopsies. So that's where the radiologist and the pathologist work together. So it's very, very situation-based, but it's all like it's definitely like a teamwork. So always this communication chain becomes very important between the radiologist, pathologist, molecular pathologist, clinician, surgeon. Everyone needs to be communicating, and we do communicate. You need to communicate and come down to a treatment.
Always.